The next question is, why is Thermal FirmaLift different from all the other procedures on the market? This is a revolutionary machine, but in order for me to explain to you the advantages of this particular procedure, I need to take a couple of steps back and explain to you the historic discovery of thermal oriented machines. Some years ago, scientists discovered that if you subject the skin as well as the muscle fibers to a temperature high enough, and usually around perhaps a 65 to 75 degrees, it is capable of shortening the collagen fibers as well as muscle fibers. Knowing that, a couple of machineries were conceived based on that principle. One that's already on the market that uses radiofrequency, and another one uses ultrasound technologies. Both machineries have a probe that goes over the skin, but unfortunately, if you were to subject the skin to a temperature as high as 65 to 75 degrees, you can easily burn the skin. And because of that, the manufacturers have no choice but to have to reduce the temperature significantly. But even then, they encounter two challenges. One, even at low temperature, it is still excruciatingly painful for the patient. And two, by having much lower temperature, it is not working as well as they wanted. So these two particular machineries, which are pretty well known on the market, have had very mixed reviews, but predominantly on the negative side. The main difference between the thermal FirmaLift procedure and the two existing machineries is the FirmaLift treatment doesn't go through the skin. It relies on this little blunt instrument, and this blunt instrument goes under the skin. And now, with it being under the skin, we can ramp up the temperature to the ideal temperature that works towards tightening and shortening collagen as well as muscle fibers. And this is the main advantage of the FirmaLift procedure. It goes under the skin. We can now increase the temperature significantly to the ideal temperature that we can shorten as well as tighten the collagen as well as muscle fibers without the risk of burning the skin. And because it goes under the skin, in spite of the fact that the temperature is high, with good local anesthetic infiltration, our patients feel absolutely no pain at all. So in summary, the main advantage of the FirmaLift procedure is we are not going on the surface of the skin, transmitting heat through the skin into the underlying muscle. That makes it impossible for us to use the high enough temperature that will shorten and tighten both the collagen and muscle fibers effectively. What we do is, with the blunt instrument, we pass that instrument under the skin, and this time bypassing the skin, and that allows us to increase the temperature significantly to the ideal temperature that the collagen fibers as well as the muscle fibers will respond to.